Welcome to your deep dive on skin cancer.
Yeah.
We got medical guides, research summaries, and even some FAQs.
Oh, wow.
But we're not just hitting the high points. We're going beyond the basics. Think of this as a masterclass in skin health.
Exactly. We'll show you how to spot those early warning signs.
Yeah.
But we're also going to break down the cutting-edge science behind the latest treatments. By the end of this deep dive, you'll be feeling confident and ready to really take control of your skin's well-being.
Okay, let's unpack this. We know skin cancer is out there. It's one of the most common cancers, especially for people who live in sunny places.
Right.
But I've always wondered, what makes melanoma so much more aggressive than other types, like basal cell or squamous cell carcinoma?
Okay.
Isn't it all like just abnormal skin cell growth?
Well, that's where it gets really interesting.
Oh, yeah.
All skin cancers, DO, involve abnormal cell growth.
Right.
But melanoma is different because of its ability to spread. Think of it this way. Basal cell and squamous cell carcinomas, they're like weeds in your garden.
Okay.
They're annoying.
Uh-huh.
They can cause damage if you don't take care of them,
Right.
but they tend to just stay put.
Okay.
Melanoma, on the other hand, is like a dandelion gone rogue.
Uh-huh.
It's spreading its seeds,
Right.
or in this case, cancer cells,
Gotcha.
through the bloodstream or lymphatic system to other parts of the body.
So it's not just about the growth itself, it's about how easily it can, take root in other places.
Exactly, and that's what makes it so dangerous.
Right.
Early detection is key.
So we've got those common risk factors.
Yeah.
Fair skin, family history, and sun exposure.
Uh-huh.
But I read somewhere that even people with darker skin tones can develop melanoma. What's the deal with that?
It's true.
Really?
While people with fairer skin have less melanin, and that acts as a natural sunscreen, anyone can get melanoma. In people with darker skin, it often shows up in less obvious places, like the palms of the hands or the soles of the feet, or even under the nails.
So no matter your skin tone, regular self-exams are a must. Speaking of self-exams, let's move on to what people should be looking for. We've all heard of the ABCDE rule,
Right.
but honestly, sometimes I feel like it's hard to know what to look for in practice.
Yeah.
Could we break that down a little further?
Absolutely. Think of yourself as like a skin detective,
Okay,
and that ABCDE rule is your magnifying glass.
gotcha.
So let's take E for evolving, for example.
Okay.
It's not just about a mole changing color or size, like really dramatically overnight.
Okay.
Sometimes it's much more subtle.
Right.
You want to pay attention to things like texture. It's like, is the surface of a mole suddenly rougher or more raised than it used to be? Or has a mole that used to be flat, has it started to develop a raised area?
Right.
Those are subtle signs that something might be up.
So even small, gradual changes are worth paying attention to.
Exactly. It's all about knowing your own skin
Right.
and what's normal for you.
That makes so much sense. Okay, so let's say you spot something suspicious. What happens next? Walk me through the diagnosis process.
So you'd see a dermatologist for a physical exam.
Okay.
They're going to examine your skin,
Okay.
literally head to toe. They'll ask about your history, and they'll assess any concerning spots.
Okay.
And if they think a biopsy is needed, it's a really straightforward procedure.
I've always been kind of squeamish about biopsies. Is it painful?
They usually use a local anesthetic, so you don't feel any pain during the procedure. You might feel a little pinch or pressure, but that's it.
Okay.
It's really important because the biopsy tells us exactly what type of skin cancer it is, if it is cancer,
Right.
and how deep it goes.
Yeah.
That information guides the entire treatment plan.
Okay, so we've got the diagnosis.
Right.
Now, let's dive into treatment options. I know there are quite a few.
Yes.
It's not always just about surgery.
Right.
Right.
We've got a whole toolkit at our disposal, and the approach really depends on the type, the size, the location of the cancer,
Okay.
and your overall health.
Okay.
Let's start with surgery.
Okay.
For basal cell and squamous cell carcinoma, surgical excision is often the go-to, but there's also Mohs surgery,
Hey.
especially for delicate areas or when we need to preserve as much healthy tissue as possible.
I've heard Mohs surgery described as microscopically controlled. What does that actually mean?
So it's a really fascinating procedure.
Okay.
Imagine this. The surgeon removes a layer of skin that contains the tumor,
Right.
and then they examine it under a microscope
Okay.
right there in the operating room.
Wow.
If any cancer cells are still present at the edges of the tissue, they'll remove another layer,
Okay.
and examine it again. And they repeat this until there are no cancer cells left.
So they're like slowly chipping away at the cancer until it's completely gone.
That's a great way to put it.
Yeah.
And because they're checking each layer so meticulously, it minimizes the amount of healthy tissue that needs to be removed.
That's incredible. It sounds so precise. What about for those precancerous spots we talked about earlier? What's the treatment approach for those?
Well, sometimes it's as simple as a topical cream that targets those abnormal cells.
Okay.
Or we might use cryotherapy,
Right.
which basically freezes and destroys those cells.
I see. So early intervention can make a big difference.
Absolutely. The goal is to stop it in its tracks
Right.
before it even becomes full-blown cancer.
So we've got surgery, topical treatments, cryotherapy. Are there other options?
There are. Radiation therapy and photodynamic therapy are also used,
Okay.
especially when surgery isn't a feasible option.
I'm curious about those. How do they work?
So radiation therapy uses high-energy rays to target and destroy cancer cells.
Okay.
It's often used for cancers that are difficult to remove surgically or for cancers that have spread to other parts of the body.
Okay.
Photodynamic therapy is a bit different.
Okay.
It involves applying a special light-sensitive cream to the skin and then exposing it to a specific wavelength of light.
Oh, wow.
And this light activates the cream,
Okay.
which then destroys the cancer cells.
So we've got a lot of tools in that treatment toolkit.
We do.
But what about melanoma? I know treatment for melanoma can be a bit more complex.
It can be, especially if it's diagnosed at a later stage.
Right.
But there have been some incredible advancements in treatment, and we're seeing real progress.
Like, what are some of those latest breakthroughs that are giving people with melanoma real hope?
One of the most exciting areas is immunotherapy,
Okay.
where we're basically teaching the body's own immune system to recognize and attack melanoma cells.
So instead of attacking the cancer directly with surgery or radiation, we're boosting the body's natural defenses.
Exactly.
Yeah.
It's like giving your immune system a set of superpowered glasses.
Oh, wow.
So it can zero in on those melanoma cells and take them out.
Okay.
And these immunotherapy drugs are called checkpoint inhibitors.
Right.
And they're making a huge difference for many people with advanced melanoma.
That's incredible. It sounds like the science fiction of just a few years ago.
It does, doesn't it?
Yeah.
And then there's targeted therapy.
Okay.
This approach focuses on blocking specific molecules
Okay.
that are driving the growth of melanoma cells. Imagine it's like cutting off the fuel supply to a fire.
So it's about like disrupting the processes that allow the cancer to thrive.
Exactly. And because these therapies target specific molecules involved in cancer growth, they tend to have fewer side effects than traditional chemotherapy.
That's a huge advantage.
Right.
Are there any other like cutting edge treatments on the horizon that you're particularly excited about?
One that's really promising is CAR T-cell therapy.
Okay.
It's still in clinical trials for melanoma, but the early results are very encouraging.
I've heard a little bit about CAR T-cell therapy.
Yeah.
Can you explain how it works?
It's actually quite remarkable.
Like it?
They take a patient's own T-cells. Those are like these soldiers of the immune system.
Right.
And they genetically modify them in a lab to recognize and attack melanoma cells more effectively.
Yeah, okay.
Then these supercharged T cells are infused back into the patient,
Okay.
where they can then go after those cancer cells with incredible precision.
It's like giving your immune system a personalized upgrade.
Exactly.
Yeah.
It's a game changer for certain types of cancer.
Right.
And we're hoping it'll be just as effective for melanoma.
That's really fascinating. So we've covered a lot of ground here,
We have.
from diagnosis to a full range of treatment options.
Yeah.
But what happens after treatment? What does life after skin cancer look like?
That's a great question.
Yeah.
And it's something we'll delve into more deeply in the next part of our deep dive.
Okay.
But I can tell you this.
Mm.
After treatment, regular follow-up care is essential.
Okay, so we'll save the details on follow-up care for part 2.
Okay.
But before we wrap up this section, I want to go back to something we touched on earlier.
Okay.
You mentioned that melanoma can sometimes appear in less obvious places, like under the nails.
Yeah,
Can you tell us a bit more about that? What should people be looking for?
absolutely.
Yeah.
When it comes to nails, be on the lookout for a dark streak that runs vertically under the nail. It might start as a small, faint line, but it can grow wider or darker over time.
Is it always a straight line?
Not necessarily. Sometimes it can be a bit irregular or jagged.
So any dark discoloration under the nail is worth getting checked out.
It's always better to err on the side of caution.
Right.
If you see something that's new or changing, especially if it involves a dark streak under the nail, make an appointment with your dermatologist.
Right.
They can examine it more closely and determine if it needs further investigation.
This is really helpful information. I think a lot of people might not even realize that melanoma can show up in such unexpected places.
That's exactly why we're doing this deep dive.
Yeah.
To empower you with the knowledge you need to advocate for your own health.
Well, I'm definitely feeling more empowered already. This has been a fascinating exploration so far. But before we move on to the next part of our deep dive, let's take a quick pause.
All right, so jumping back into our deep dive on skin cancer.
Okay.
Before the break, we were talking about how melanoma can show up in some unexpected places.
Right.
And how important those regular self-exams are.
Yeah, you mentioned we'd be digging deeper into life after skin cancer treatment.
Exactly.
What does that involve?
Well, first, let's acknowledge that the experience can be, pretty varied.
Okay.
It depends on the type of skin cancer, the stage at diagnosis, the treatments used,
Right.
and, of course, each person's individual response.
So there's no one-size-fits-all approach to recovery?
Not at all.
Okay.
For some, it might involve monitoring the surgical site,
Right.
managing any potential side effects from treatment,
Okay.
and attending regular follow-up appointments with their dermatologist.
Yeah.
For others, especially those with more advanced melanoma, it might include ongoing immunotherapy or targeted therapy, along with, more intensive monitoring.
That makes sense. So it's about adapting the follow-up care to each person's specific needs.
Exactly.
Yeah.
And that's why that close relationship with your dermatologist is so crucial.
Right.
They really become your partner in navigating life after skin cancer.
Speaking of partnerships,
Yeah.
I was reading a study that found
Okay.
that patients who really actively engaged in their follow-up care, asking questions,
Right.
really understanding their treatment plan,
Yeah.
tended to have better outcomes.
Yeah.
Why do you think that is?
I think it comes down to a sense of empowerment. When patients understand their condition and are actively involved in their treatment decisions,
Right.
they feel more in control.
Okay.
And I think that can have a really positive impact
Yeah.
on their emotional well-being and their overall health.
So it's not just about blindly following doctor's orders. It's about being informed and active in your own health journey.
Exactly.
Yeah.
It's a collaboration.
Okay, so we've talked about the importance of follow-up care and being an empowered patient.
Yeah.
But what about prevention?
Oh, okay.
We touched on sun protection earlier.
Right.
But are there other lifestyle factors
Yeah.
that can play a role in reducing skin cancer risk?
There are.
Like what?
Diet and exercise are two big ones.
Okay.
Studies have shown a link between a diet rich in fruits, vegetables, and antioxidants
Right.
and a lower risk of skin cancer.
So those colorful fruits and veggies aren't just good for our overall health, they might be protecting our skin too.
Exactly.
Okay.
And don't forget about exercise.
Right.
Regular physical activity can boost circulation, reduce inflammation,
Okay.
and support overall immune function,
Right.
all of which can contribute to healthy skin.
This is all great news.
It is.
It means we have some control over our skin health.
Right.
Not just about genetics or luck.
Exactly.
Yeah.
You have the power to make choices that support your skin's well-being.
Okay, so we've covered prevention, treatment, and life after treatment.
Yeah.
Now I want to shift gears a bit.
Okay.
And talk about something that's been in the news a lot lately.
Okay.
Artificial intelligence.
Interesting.
I've read about these AI algorithms being developed
Yeah.
to help detect skin cancer.
Uh-huh.
Is this something dermatologists are actually using?
It's definitely an area of intense research and development.
Okay.
It holds a lot of promise.
Yeah.
AI algorithms are being trained on massive data sets of skin images, learning to recognize patterns and features that might indicate skin cancer.
So it's like having a superpowered dermatologist in your pocket.
In a way, yes.
Wow.
These AI tools are designed to assist dermatologists,
Okay.
not replace them.
Right.
They can help flag suspicious lesions that might otherwise be missed,
Okay.
especially in those hard-to-see areas.
But it's still important to
Yeah.
see a real-life dermatologist for a proper diagnosis, right?
Absolutely.
Okay.
These AI tools are powerful,
Right.
but they're not perfect.
Yeah.
They're still under development.
Yeah.
And it's crucial to have a trained dermatologist interpret the results
Right.
and make the final diagnosis.
That makes sense.
Yeah.
So technology can be a powerful tool, but it's still just a tool.
I agree.
Yeah.
Human expertise is still essential.
Okay. So AI is changing the game when it comes to skin cancer detection.
Yeah.
What about treatment? Are there any technological advancements on the horizon that have you particularly excited?
One area that's really fascinating is 3D printing.
Okay.
Researchers are experimenting with 3D printed skin grafts
Wow.
that could be used to repair skin defects after surgery for skin cancer.
So instead of using traditional skin grafts,
Right.
which involve taking skin from another part of the body,
Yeah.
we could create like custom designed skin grafts in a lab.
Exactly.
Wow.
It's still early days, but this technology has the potential to revolutionize reconstructive surgery for skin cancer patients.
That's really exciting. It sounds like the future of skin cancer treatment is incredibly bright.
I think so too.
Okay, I have one more question before we wrap up this part of our deep dive.
Okay.
It's something I've always been curious about.
Very.
Tanning beds.
Oh, yeah.
I know they're marketed as like a safe way to get a tan,
Right.
but I've always been skeptical.
Okay.
What's the real story?
The truth is, there's no such thing as a safe tan. Tanning beds emit ultraviolet radiation, which is a known carcinogen.
Oh, wow.
In fact, the World Health Organization classifies tanning beds as a Group 1 carcinogen,
Okay.
meaning they are known to cause cancer in humans.
So they're just as dangerous as the sun.
In some ways, even more so.
Really?
Tanning beds often emit higher levels of UVA radiation than the sun,
Okay.
and UVA rays penetrate deeper into the skin, causing more damage.
Wow. I had no idea they were that potent. So the bottom line is tanning beds are a big no-no.
Absolutely.
Yeah.
There's no safe way to tan.
Okay.
Embrace your natural skin tone and protect it from the sun's harmful rays.
Right.
That's the best way to keep your skin healthy and reduce your risk of skin cancer.
That's great advice.
Yeah.
You know, this conversation has made me realize something.
Okay.
We often talk about skin cancer in terms of prevention, detection, and treatment.
Right.
But what about the emotional and psychological impact of a skin cancer diagnosis?
Yeah.
That's something we haven't really touched on yet.
You're right. It's an important aspect of the skin cancer journey that often gets overlooked.
Yeah.
A skin cancer diagnosis can be a very emotional experience.
Right.
There's often a lot of fear, anxiety, and uncertainty.
Yeah.
And for some people, there might be body image concerns.
Right.
Especially if they've had surgery or scarring.
So it's not just about the physical aspects of the disease, it's about the emotional and psychological impact as well.
Exactly. And that's why it's so important to have a support system in place.
Okay.
Talk to your loved ones, your friends, your doctor, or a therapist if you need to. Don't be afraid to ask for help.
And what about support groups?
Yeah.
Are those helpful?
Support groups can be incredibly valuable.
Yeah.
They provide a safe and supportive space for people to share their experiences,
Right.
connect with others who understand what they're going through, and learn coping strategies.
It sounds like having that sense of community and shared experience can make a big difference.
It can.
Yeah.
Knowing you're not alone in this journey can be incredibly empowering.
Okay, so we've talked about the emotional and psychological aspects of skin cancer.
Yeah.
Now, I want to touch on something that's often a major concern for patients.
Okay.
The cost of treatment.
All right.
I know it can be quite expensive,
Yeah.
especially for those with advanced melanoma.
You're right.
Yeah.
The cost of treatment can be a significant barrier for many people.
Right.
It can vary widely depending on the type of skin cancer, the stage of the disease, and the treatment options chosen.
And I know insurance coverage for skin cancer treatments can be pretty complicated.
It can be.
Yeah.
It's important to talk to your insurance provider to understand your coverage
Okay.
and explore all your financial options.
Right.
Don't be afraid to advocate for yourself and ask for clarification if you're not sure about something.
Are there any resources available for people who are struggling to afford treatment?
Yes, there are.
Okay.
Many hospitals and cancer centers have financial assistance programs,
Okay.
and there are national organizations that provide financial support and resources to people with cancer.
That's good to know. It's important for people to realize they're not alone in this.
Exactly.
Yeah.
There's help available.
This has been such an informative conversation.
Oh,
We've
yeah.
covered so much ground, from prevention and detection
Right.
to the latest treatments and the emotional and financial aspects of the disease. But before we wrap up our deep dive,
Okay.
I want to circle back to something you mentioned earlier,
All right.
the importance of regular self-exams.
You're right. It's one of the most powerful tools we have for detecting skin cancer early,
Right.
when it's most treatable.
And we talked about the ABCDE rule.
Mm-hmm.
But can we break down exactly how to do a thorough self-exam?
Absolutely.
I think a lot of people might be unsure of where to start or what to look for.
Here's a step-by-step guide to performing a skin self-exam.
Okay.
So first, find a well-lit room and a full-length mirror.
Okay.
You'll also want to have a hand mirror handy
Right.
for those hard-to-see areas.
Gotcha.
Start with your face.
Okay.
Examine your face carefully,
Okay.
including your ears, nose, lips, and scalp.
Right.
Use the hand mirror to check your scalp,
Mm-hmm.
parting your hair to get a good look at all areas.
Right.
Then move on to your neck, chest, and torso.
Right.
Check both the front and back of your body.
Gotcha.
Examine your arms carefully. Don't forget to check your underarms, the palms of your hands,
Okay.
and between your fingers.
Mm-hmm.
Next, check your legs.
Okay.
Examine your legs, including the tops of your feet, the soles of your feet, and between your toes.
Right.
And don't forget those hard-to-see areas.
Okay.
Use the hand mirror to examine your groin area, buttocks, and the back of your neck.
It sounds like a pretty comprehensive process.
It is.
Yeah.
And you want to be thorough.
And what are we looking for specifically during these exams?
You're looking for anything new, changing, or unusual.
Okay.
This includes new moles.
Right.
Any new moles that appear should be checked by a dermatologist.
Uh-huh.
Changing moles.
Uh-huh.
Look for changes in the size, shape, color, or texture of existing moles.
Gotcha.
Sores that don't heal.
Okay.
Any sores that don't heal within a few weeks should be evaluated by a doctor.
Right.
Spots that bleed or ooze.
Okay.
This could be a sign of skin cancer.
Hmm.
Rough or scaly patches.
Right.
These could be precancerous or cancerous.
Gotcha.
Itchy, tender, or painful spots. Pay attention to any areas that are causing discomfort.
And we should be using that ABCDE rule as our guide.
Right, exactly.
Right.
The ABCDE rule is a great tool for assessing moles.
Right.
Asymmetry. One half of the mole doesn't match the other half,
Okay.
border. The border is irregular, notched, or blurred color. The color is uneven or varies within the mole diameter. The mole is larger than 6 millimeters in diameter, about the size of a pencil eraser.
Okay.
In evolving, the mole has changed in size, shape, color, or texture.
So if a mole exhibits any of those ABCDE characteristics, it's worth getting checked out by a dermatologist.
Absolutely.
Okay.
It's always better to err on the side of caution when it comes to skin cancer.
Okay, so we've covered the how-to of self-exams.
Uh-huh.
Now, what if someone finds something suspicious? What should they do?
The most important thing is to make an appointment with a dermatologist as soon as possible.
Yep.
They can examine the area more closely, perform a biopsy if necessary, and discuss the best course of action.
And I know you've said this before, but it's worth repeating. Early detection is key when it comes to skin cancer.
It really is.
Yeah.
When skin cancer is detected and treated early,
Right.
it's highly curable.
This has been such an eye-opening conversation.
It has been.
We've covered so much ground, from the basics of skin cancer to the latest advancements in treatment and beyond.
We have.
But before we wrap up our deep dive, I want to touch on something that often gets overlooked. The importance of sun protection for children.
That's a great point.
Yeah.
Children are especially vulnerable to the sun's harmful rays
Okay.
because their skin is thinner and more sensitive.
Uh-huh.
And sunburns during childhood can significantly increase the risk of developing skin cancer later in life.
So what are the best ways to protect children from the sun?
The same principles apply to children as to adults.
Okay.
Seek shade,
Right.
especially during peak sun hours from 10 a.m. to 4 p.m.
Okay.
Dress children in protective clothing, including hats with wide brims, sunglasses that block UV rays, and long-sleeve shirts and pants.
Okay.
Use sunscreen.
Right.
Apply a broad-spectrum sunscreen with an SPF of 30 or higher to all exposed skin,
Right.
even on cloudy days.
Wow. Okay.
Reapply every 2 hours or more often if swimming or sweating,
Yeah.
and be a good role model.
Yeah.
Children learn by watching their parents and caregivers.
That's right.
Set a good example by practicing sun safety yourself.
Okay, so sun protection for children is crucial.
It is.
Are there any other tips you have for parents or caregivers?
A few things to keep in mind.
Okay.
Babies under 6 months of age should be kept out of direct sunlight as much as possible.
Okay.
Their skin is extremely sensitive.
Gotcha.
Water, snow, and sand reflect the sun's rays, so be extra careful in these environments.
Okay.
And check the UV index before heading outdoors.
Right.
The UV index is a measure of the strength of the sun's UV rays.
Right.
The higher the index, the greater the risk of sunburn and skin damage.
This is all really helpful information. I think a lot of parents might not realize how important sun protection is for their children.
It's one of the most important things we can do to safeguard their health.
Okay, so we've covered sun protection for children.
Right.
Are there any other aspects of skin cancer that we haven't touched on yet?
One thing that often comes up is the issue of skin cancer disparities.
Wow.
Unfortunately, certain populations experience higher rates of skin cancer and worse outcomes.
That's concerning. Can you elaborate on that a bit?
Sure.
Yeah.
For example, people with darker skin tones, while less likely to develop skin cancer overall,
Okay.
are often diagnosed at later stages
Right.
when the disease is more advanced.
Mhm.
This is partly due to a lack of awareness
Okay.
among both patients and healthcare providers about how skin cancer can present in darker skin.
So it's not just about, like, biological differences in skin pigmentation.
Right.
It's also about systemic factors that can influence access to care and early detection.
Exactly. And this is a critical issue that needs to be addressed.
Right.
We need to increase awareness among healthcare providers
Right.
about the unique ways skin cancer can manifest in different skin tones.
Right.
And we need to make sure that all communities have access to quality dermatological care.
That makes so much sense. Equity and access are crucial when it comes to healthcare.
Absolutely.
Yeah.
Everyone deserves the best possible chance of early detection and successful treatment,
Right.
regardless of their skin tone or socioeconomic background.
Okay, I think we've covered just about everything there is to know about skin cancer.
I think we have.
This has been such a fascinating and insightful deep dive.
I agree.
Before we wrap things up,
Yeah.
I want to make sure we leave our listeners with some clear takeaways.
Okay.
What are the most important things people should remember about skin cancer?
I think the three most important things are prevention, early detection, and seeking professional help.
Okay, let's break those down a bit.
So,
What are the best ways to prevent skin cancer?
sun protection is key.
Right.
Wear sunscreen with an SPF of 30 or higher every day, even on cloudy days.
Okay.
Seek shade during peak sun hours,
Mm-hmm.
and cover up with protective clothing, hats, and sunglasses.
And what about those other environmental factors we talked about?
Right, so if you work with potentially harmful chemicals,
Okay.
follow safety guidelines and wear protective gear.
Uh-huh.
And if you're concerned about radiation exposure,
Right.
talk to your doctor.
Okay. So we've covered prevention.
Mm-hmm.
What about early detection? Why is that so important?
Skin cancer is highly treatable when it's caught early.
Right.
The earlier it's detected, the better the chances of successful treatment.
Yeah.
That's why regular self-exams are so crucial.
And how often should people be doing self-exams?
Aim for once a month.
Okay.
Familiarize yourself with your skin so you can notice any changes.
And what should people be looking for during these self-exams?
Look for any new moles,
Okay.
changes in existing moles,
Uh-huh.
or any sores that don't heal.
Right.
Remember the ABCDE rule?
And if someone sees something suspicious during a self-exam, what should they do?
Make an appointment with a dermatologist right away.
Okay.
They can determine if it's something to be concerned about.
So seeking professional help is the third key takeaway.
Exactly.
Right.
Don't try to diagnose yourself.
Right?
If you have any concerns about your skin, see a dermatologist.
Okay.
They're the experts.
Excellent advice. Well, I think we've covered everything we set out to cover today.
I agree.
This has been an incredibly informative deep dive.
It has.
This deep dive has really got me thinking about the importance of taking care of our skin.
It is important.
It's our largest organ,
It is.
and it plays such a vital role in protecting us. We need to treat it with respect.
I couldn't agree more.
And you know what? This deep dive has also inspired me to be more proactive about my own skin health.
That's great.
I'm definitely going to be scheduling my annual skin check with my dermatologist very soon.
Good for you.
We've covered a lot in this deep dive.
We have.
Understanding different types of skin cancer,
Right.
the science behind those cutting-edge treatments,
Yeah,
the importance of prevention and early detection.
absolutely.
But before we wrap up, I want to talk about something we haven't discussed yet.
Okay, I'm all ears.
We've talked about how empowering knowledge can be,
Uh-huh.
how important it is to be, proactive about our skin health.
Right.
But I think it's also important to,
Yeah.
acknowledge the emotional and psychological side of things.
Okay.
A skin cancer diagnosis can be incredibly stressful,
It can.
and the treatment journey itself can be challenging.
Yeah, you're absolutely right. It's so important to address that emotional and psychological well-being
Right.
of individuals who are facing a skin cancer diagnosis.
Exactly.
It's not just about treating the physical disease.
Yeah.
It's about supporting the whole person.
Exactly. It's about acknowledging the fear, the anxiety, the uncertainty
Absolutely.
that can come with a diagnosis like this.
Yeah.
And for some people, there might be body image concerns, especially if they've had surgery or scarring.
Absolutely. Those are all very real and valid concerns.
Yeah.
And I think it's so important
Right.
to create a space for people to talk about these feelings
Right.
openly and honestly.
So what are some ways that we can support people going through this?
I think, first and foremost, it's about listening without judgment.
Okay.
Just let them express their fears, their anxieties, without feeling like they need to, put on a brave face.
Right.
Sometimes just having someone to listen can make a world of difference.
Absolutely. Creating that safe and supportive space for them to be vulnerable.
Exactly.
Yeah.
And I think beyond listening,
Uh-huh.
we can also offer practical support.
Okay.
Help with things like transportation to appointments,
Right.
meal preparation, childcare.
Yeah.
These things can take a huge burden off their shoulders.
Absolutely. It's about showing up for them in tangible ways.
Right. Yeah.
Yeah.
And then there are resources like support groups and therapy.
Right.
Connecting with others who have gone through similar experiences
Mm-hmm.
can be incredibly validating
Right.
and empowering.
Yeah.
And a therapist can provide tools and strategies for coping with the emotional and psychological challenges of a skin cancer journey.
It sounds like there's a whole network of support available
There is.
if people know where to look.
Yeah, and it's important to remember
Yeah.
that seeking support is a sign of strength, not weakness.
Right.
It takes courage to reach out for help when you need it.
Absolutely. That's such an important message.
It is.
Now, before we wrap up this deep dive,
Yeah.
I want to touch on something else
Okay.
that can be a major source of stress
Right.
for people with skin cancer.
Okay.
The financial burden.
Ah, yeah.
I know skin cancer treatments,
Right.
especially some of those newer therapies,
Uh-huh.
can be quite expensive.
You're absolutely right.
Yeah.
The financial aspect of skin cancer treatment can be incredibly overwhelming for many individuals.
Right.
And navigating insurance coverage
Yeah.
can be a complex and frustrating process.
So what advice do you have for people who are facing this?
I think, first, don't be afraid to ask for help.
Okay.
Talk to your doctor, your hospital's social work department,
Right.
or a financial counselor.
Okay.
They can help you understand your insurance benefits,
Yeah.
explore potential financial assistance programs,
Right.
and connect you with resources that can, ease the burden.
It sounds like there might be more options available than people realize.
There often are.
Yeah.
There are foundations,
Okay.
nonprofit organizations,
Huh.
and even pharmaceutical companies that offer financial assistance programs
Right.
to help patients access the treatments they need.
So it's about being proactive and advocating for yourself.
Exactly. Don't suffer in silence.
Right.
Reach out for help and explore all your options.
That's great advice. Well, I think we've covered just about everything
I think so too.
we set out to cover in this deep dive
Right.
into the world of skin cancer.
Absolutely.
We talked about different types of skin cancer,
Mhm. Yeah.
risk factors, the latest treatments,
Mhm.
the importance of prevention,
Mhm.
early detection,
Right.
the emotional and financial aspects of the disease.
It's been a really comprehensive and insightful conversation.
I agree.
I hope our listeners feel empowered
Yeah.
to take charge of their skin health and advocate for themselves.
I couldn't agree more. I want to reiterate something you said earlier.
Yeah,
Knowledge is power.
it is.
The more we understand about skin cancer,
Uh-huh.
the better equipped we are to protect ourselves and our loved ones.
Absolutely. And that's exactly what we've aimed to do in this deep dive. We've
Yeah.
empowered our listeners with the knowledge they need
Yeah.
to make informed decisions about their skin health.
So as we wrap up this deep dive,
Okay.
what are the key takeaways you want our listeners to remember?
Well, I think the most important message is this. Skin cancer is a serious disease, but it's also highly preventable
Yeah.
and treatable, especially when it's caught early.
And how can people take charge of their skin health
Yeah.
and, reduce their risk?
It starts with sun protection.
Right.
Make it a habit to wear sunscreen every day, seek shade during peak sun hours, and cover it up with protective clothing.
And beyond sun protection.
Be vigilant about self-exams. Get to know your skin and be aware of any changes.
Uh-huh.
If you see something suspicious, don't hesitate to see a dermatologist.
And finally,
Remember that you're not alone.
Yeah.
There's a wealth of information and support available
right.
for people with skin cancer. Reach out to your doctor, your family and friends, support groups, and national organizations.
Well said. Those are powerful words to end on.
They are.
Thank you so much for joining us on this journey into the world of skin cancer.
My pleasure.
We hope you found it informative and empowering.
Absolutely.
And to our listeners, thank you for tuning in. We wish you all healthy and happy skin.